Welcome to another Lessons in ADHD online video from the makers of Concerta. The third video in our series, Through a Mother's Eye, is presented by real moms sharing their personal journeys of learning and living with their children's ADHD. Let's listen in on Anne, Monica, and Christine and find out about the success their children found.
I know that when Aiden was diagnosed with ADHD, I think my first feeling was just complete relief. I wasn't angry. I was just kind of happy in a weird way to know that there was something that has a name. And if you know what it is, you can actually work with it.
I can relate to what you're saying. I just knew something was different. Right. And having two other children, and they're much older than Miles. And I just thought he was busy. He's just being a hand, you know. It's just knowing that here it is, it's ADHD. I'm not crazy. My house is not crazy.
You know, you'd think that when you get the diagnosis of ADHD, that would kind of be scary, but I felt the same way too, because at least now you know your child isn't bad and they're not being lazy and, you know, they're not being rude on purpose. It's because they have this thing called ADHD, and it was good to finally be able to put a name to it and actually get some help with it. You know, I remember when I took Nicole to the doctor and she first suggested putting her on medication, and at first I really resisted because honestly I was a little bit afraid. I'd heard a lot of things about medications and pros and cons, and I think more than anything though I was worried about the judgment from friends and family. All these people were giving me advice and telling me things, and it was very confusing. And initially, I didn't put her on medication. I tried some herbal supplements, but, you know, they didn't work. They just didn't work. And I realized I needed to go back and give it a try. I figured what could be the worst that would happen? I mean, try it for a couple of weeks and see how it goes. And I'll tell you, I mean, after just 2 weeks, I noticed a huge difference.
Wow.
So
I know when they first suggested medication for Miles, when his doctor first suggested it, I said, well, let me think about it. How long do I have to think about it? I need to think about it. I need to do my homework. And if it does work, how long is it going to take it to work before I honestly start to see some sort of difference, or if there's a slight bit of change? But after doing my research, I decided to go with the medication.
When Aiden finally went on Concerta, I think after a few days, what was really the turning point for me in believing medication is okay and would work for him is he started I think on a Monday, and on a Friday it was 5, 6 o'clock at night, bad time of the day. There were a lot of people. And in the middle of dinner, he just out of nowhere said, Mommy, I think my medicine is working. And I said, well, okay, why do you think that? And he said, because my brain hears you better. And it's not words that we used with him, and so it was kind of like my sign to say, you know what, Mom, it's okay. It did just make me cry.
At Miles School, what his teacher does, she does a daily report, and it's happy faces or smiley faces for the kids and the progress. And when he would come home, his would always be sad faces all across the board. And so lately he's come home and there's happy faces. They're all smiling. I'm like, high five, high five. So we started doing one at home, happy face, sad face, so that he can see that his progress is not just in school, although I'm very proud because my phone isn't ringing.
I think one of the things that we really noticed is that there's so much less tension and stress in the household because we weren't yelling at Nicole all the time.
Right.
I think before Concerta, you know, we were just constantly yelling at her and because she wasn't listening, and all of a sudden she was able to listen. She got ears, and it was just such a huge difference in our family life. We were all able to get along and go someplace without a fight in the car or a fight with her brother.
Or sit down at the dinner table and finish a meal.
I know that since Aiden has been on medication, I'm constantly being asked by other parents who have children with ADHD what I think about medication. Do you get that?
In fact, I belong to a support group for parents who have children with ADHD. I'd say about half of the kids in the group are actually taking Concerta. But a lot of times there's newer parents that join the group and they ask me about my experience. And now, of course, I'm not a doctor, and I always recommend that they seek their own doctor's advice. But, you know, there's a lot of decisions I've been unsure about as a parent, and this is one that I feel confident in. I know that I'm doing the right thing for my child.
I would agree, and I think it is a very, very personal choice and a tough one. I think we'd all agree. It was a hard one to make. But I do think that when you think about the risk of doing it versus the risk of not doing it, I really try to emphasize what you're risking is your child not having the opportunity to live the kind of life that he deserves.
And giving them a chance.
That's all I want.
You're here. Mother's Day.
We invite you to return to Concerta.net to watch future episodes of Lessons in ADHD. Talk to your doctor for proper diagnosis and treatment of ADHD. Only a doctor can decide whether medication is right for you or your child. Concerta should not be taken by patients with significant anxiety, tension, or agitation, allergies to methylphenidate or other ingredients in Concerta, glaucoma, Tourette's syndrome, tics, or family history of Tourette's syndrome. Abuse of methylphenidate may lead to dependence. Tell your healthcare professional if your child has had problems with alcohol or drugs, has had depression, abnormal thoughts or visions, bipolar disorder, seizures, high blood pressure, or has had any heart problems or defects. If your child develops abnormal thinking or hallucinations, abnormal extreme moods, and or excessive activity, or if aggressive behavior or hostility develops or worsens while taking Concerta, consult your healthcare professional. The most common adverse events reported in children receiving up to 54 milligrams were headache, upper respiratory tract infection, and abdominal pain. The most common adverse events reported in adolescents receiving up to 72 milligrams were headache, accidental injury, and insomnia.